Hello again, I'm Lennox Hoyt, MD, fellowship-trained urogynecologist and board-certified pelvic floor surgeon. We're talking about how is urinary incontinence diagnosed. And the most important thing to consider about any symptom like urinary incontinence is exactly that, the symptom. So the urinary incontinence diagnosis begins with a patient, a woman, complaining, "Hey, I'm leaking stuff into my underwear. I'm leaking urine. I think it's urine. When I cough, I laugh, I sneeze, I have a gush of urine. Or I feel an urge to urinate and I try to get to the bathroom and I can't make it to the bathroom. I leak before I get there." That's where the diagnosis starts. And the question is, if you're being treated by a physical therapist, usually a pelvic floor physical therapist for pelvic floor issues, you can talk to that physical therapist about the fact that you're leaking. There is a specialty or subspecialty of physical therapy called female pelvic floor physical therapy. A physical therapist who is qualified as a female pelvic floor physical therapist is perfectly capable and able to diagnose your urinary leakage and to offer non-invasive treatments that are pretty sophisticated, that are geared towards helping you resolve your urinary incontinence issues. They can get very good at it, and in fact, many practitioners would advise a course of pelvic floor specific physical therapy to address early urinary incontinence. When the physical therapy is not able to solve your problem or resolve your problem and you've had a good course of it, then the next steps include seeing a urogynecologist or pelvic surgeon who can address, diagnose and address more definitively with a surgical treatment for your urinary incontinence. It's really also important to know that your physical therapist, your female pelvic floor physical therapist, is appropriately connected to a network of practitioners who he or she can recommend in the event that the physical therapy is not getting the desired effect or appropriately getting you cured of your urinary incontinence. That network of specialists includes urogynecologists, fellowship-trained board-certified urogynecologists, fellowship-trained board-certified urologists, who can design an appropriate treatment plan for you beyond physical therapy in the event that the physical therapy does not have adequate results for you. It's gonna be really important that not just any physical therapist can treat female pelvic floor disorders. They have to be subspecialized in the area of female pelvic floor physical therapy in order to be able to offer appropriate, credible treatment and successful treatment of your urinary incontinence. It's going to be really important. The orthopedic physical therapist cannot do it. The occupational physical therapist or the occupational therapist cannot do it. This is not as simple as, okay, go do Kegels and use a squatty potty to address your problem. It's much more complex than that, and female pelvic floor physical therapists have an arsenal of tools, testing, and modalities available to them that can often successfully treat your urinary incontinence. So if you think you have urinary incontinence and you're being seen by a physical therapist, make sure you get evaluated by a female pelvic floor physical therapist who can appropriately diagnose and treat your urinary incontinence. I'm Lennox Hoyt. Thank you so much for watching. We'll talk to you again soon.